Good morning. Today we'll be talking about asthma and how to care for people with asthma. We had last week was the World Asthma Day. And it's important that we remind ourselves of some of these very, very important conditions that can lead to death. Good morning, Dr. Anga. It's such a pleasure to have you back with us on the program. Thank you for coming.
Good morning. Thank you for having me.
Now, we want to talk about asthma. Some people think they know all about it, but we do know that it's important to keep it in mind, particularly with the fact that it can kill, and it kills people, especially who take it for granted. So can you tell us, what is asthma?
Well, asthma is a disease of the lungs. And in asthma, you have spasm of the muscles of the air passages, and you also have increased mucus production. And these two mechanisms lead to narrowing of the air passages, and then people with asthma experience difficulty in breathing.
Now, it's common in children, isn't it? Because one of the things as we noticed, is an increase, almost an epidemic of asthma coming on nowadays, with so many more children having asthma and so many more people getting asthma. But what is also interesting is we see people with asthma, adults with asthma, starting in asthma. So what is the life history of asthma? How does it really start? What should people expect?
Well, we, as a pediatrician, I have to emphasize that we rarely diagnose asthma. We rarely diagnose it before the age of 5, because children who have respiratory viral infections have narrower air passages, so they tend to wheeze some children will wheeze when they have a viral infection. And not all children who wheeze go on to develop asthma. So we rarely diagnose it before the age of 5. From age 5 and above, you can make a diagnosis of asthma, which will come to based on symptoms and findings on physical examination. You can also have adult onset asthma, which starts from the age of 18.
Now, who gets asthma? So can you tell us what the symptoms are? So for people who are listening and want to know exactly what asthma is, how it's diagnosed.
So the symptoms of asthma include a cough, which may be persistent or intermittent. You may also experience chest tightness and difficulty in breathing. And you also sometimes hear what we call a wheeze, which is like a whistling sound, which can be clearly audible. You can hear it when you're listening to the person breathe, or you can also hear it when you listen to that person's chest with the doctor's stethoscope. So when you want to diagnose asthma, it would be based on the history. So you would ask the person about these symptoms, and then you would also look into the background to find out if they have a family history of asthma or background of allergies, which we would call atopy. So asthma is associated with other diseases like eczema and hay fever, which we call allergic rhinitis. In diagnosing asthma as well, you would also want to examine the person and listen to the chest to see if you can hear an audible wheeze.
Now, you mentioned the word allergy. And, that's something that we'd like to sort of explore. You've also talked about, the issues, and I don't know whether we want to talk about the family history right now and talk about, you talk about associated conditions, but the fact that it's within families. Now, the issue for me is with allergies. Some people say, I have allergies that cause itching, allergies that cause asthma. Some people have, had onsets of allergies, and intolerances, and then gotten asthma, particularly as adults. So can you tell us or explain the relationship between allergies and asthma?
So first of all, we need to understand what we mean by an allergy. So if you have an allergy, you have a response to a substance which would otherwise not induce any reaction in other people. So it's an exaggerated response to what might seem harmless to a person who doesn't have allergies. So we have reactions to things like dust, house dust mite, smoke, and that is what you would call an allergy. Where you have breathing problems in people who have allergies, it's called allergic asthma. Of course, you can have asthma that's not associated with allergies, and that's called non-allergic asthma.
So now we have some people who, for example, say they've gone abroad and they've been prescribed EpiPens for some allergies, and that sometimes it interacts and sometimes they get wheezing and reactions when they eat certain foods. Can you talk about that?
So in these people, they have a more than exaggerated response, a life-threatening response to the allergen. So in that situation, you want immediate treatment to relieve the symptoms so that they do not die from the reaction. And an EpiPen contains a drug called adrenaline, and that's a short-term relief to open up the airways and to stop the immune reaction. That's why they're prescribed the EpiPen, because they've had a life-threatening episode.
Now, some people say that asthma is something they have grown out of. They haven't had asthma for years, and that they stop carrying even their Ventolin around. And we've had unfortunate cases of people who've died on the expressway, being in traffic, unable to get to source to relief. Now, how common is this? How much should a person, talk, if you can tell us about the history of how the progress of an asthmatic, and how worried should an adult be if they know they've had asthma as a child and they've been symptom-free, shall we say, for a number of years? How seriously should they take it?
Well, children, when you have asthma beginning in childhood, they seemingly tend to grow out of asthma, but it's not, there's no cure for asthma. It's a chronic condition and it's a lifelong condition. So in the growing out, in a sense, is not that you've been cured. So you need to be aware of the fact that it may come back later, and you need to track your asthma symptoms so that you are aware and know when you might have an attack. When you have asthma starting in adulthood, you're less likely to grow out of that. So in that sense, it's easier, yes, and you know that you have to continue to track your asthma and keep your inhaler with you. But the likelihood of having asthma come back in adulthood is less when it starts in childhood, as opposed to when you have asthma beginning in adulthood.
Well, I think it's so important that we understand that. And in Nigeria, there seems to be an increase in asthma. And unfortunately, there's also seems to be an increase in different strata. So it's not just sort of it was once considered sort of an elite or elite, condition. Now it comes across or cuts across everyone and everywhere. But people don't really know how to pick it up. So how would you advise, or what would you advise, on generally how to pick it up and how people should, be aware of this condition?
So we need to increase awareness, and one such way is what you're doing. We've already talked about how it presents and how to diagnose and know that you have asthma. So communication to the general public as to what the symptoms are of asthma, the communication that it can be controlled and that you can live a long, active life and live with asthma and control your symptoms. And we also need to communicate what to do when there's an emergency. But to be most reassuring, I think would be the way forward, and to communicate and educate the general public.
Thank you. I think that we have to be more effective in communicating it across the board. But the issues about environmental pollution and how the environment affects asthmatics. Can you tell us a bit about that? And is there anything the government can do to help asthmatics in this regard?
Well, with asthma, as we've discussed, although we haven't gone into much depth about them, we have to understand what the triggers for asthma are. And as you've just said, it includes air pollution, exposure to noxious chemicals, and then we've talked about allergy-induced asthma. We also have within other areas where we use kerosene and charcoal fires that can make or induce asthma reactions in people. Then environmental pollution, it's something that the government obviously would need to address, but governments all over the world, including Nigeria, because we have a lot of air pollution, particularly in the riverine areas with the oil, within the oil industry, gas fumes and chemicals causing chemical-induced asthma. So it's something that needs to be brought more to light and communicated. Research also showing the extent of the issue and the disease burden in Nigeria would also bring that to the forefront.
Thank you very much. Thank you, Yewande, for coming on the program. It's a pleasure to have you with us. And thank you. We'd like you to, okay, I want to start again. Sorry, I'm a bit distracted. I don't know why I've not been able to get myself back in the center. That's better. Okay, I'm better now.
Oh.
So I'm starting again.
Yeah.
Good morning, Yewande. Thank you for coming on with the Just Breathe Foundation. Can you tell us, what is the Just Breathe Foundation? What is it about? Why did it start? And can you also share your own personal journey with asthma with us?
Thank you very much, Ma. My name is Yewande Sheu, and I'm the founder of Just Breathe Asthma Foundation. Just Breathe Asthma Foundation was an idea I had during COVID, because during COVID, there was a lot of people who have asthma, who have lung issues, are more prone to getting COVID. And I could see a lot of panic and fear in the eyes of a lot of my friends and family who had asthma. So at first, I just wanted it to be like a safe space where people could just come and talk, like a group chat. And there's one thing to interact with people who know what asthma is, and then for other people who don't really know. So it was just like a group of friends coming to just share experiences during COVID. And I noticed that it's got a lot of people were willing to join. On the first day, we had over 50 members, and I was like, okay, let me just make this thing official. And then I started the process for registration as an NGO and everything, and we were able to do that in like 2 years. That was like last year. So Just the Asthma Foundation right now is on WhatsApp majorly, because we have members from all over Nigeria, some of them outside Nigeria. We have medical personnel who are always like on standby to answer questions, emergency questions. And so it's just a safe space where people could actually come and talk about asthma with people who actually understand what it's like to have asthma. And I noticed that me being asthmatic myself too, people had this trust and faith that, okay, this person wasn't just doing it for charity's sake because she has asthma, so she can actually relate with everything that we are going through. And so that has helped us like gain a lot of members and volunteers and even sponsors too. So for now, we will be 3 in September, and World Asthma Day was a very, very great day because we had the opportunity to talk about asthma. We had an awareness program in UNILAG, and we gave out inhalers to some asthmatics. So for me, asthma hasn't been really easy. Mine was inherited. My dad has asthma, my younger brother has asthma too. So it was something like we all knew. My mother has to be a very strong person, taking care of 2 kids, and my husband has been asthmatic too. So like she did a very great job. But growing up, I didn't really see much information about asthma as we had seen about sickle cell, malaria. So it just made it look like, oh, when you tell people you have asthma, they'll be like, oh, maybe you're lazy. And then some other people see you as weak, maybe because you can't do some things like for those who triggers are exercise, they can't exercise, and people just look at them as weak. And we have seen cases in the workplace too. A lot of people don't get employed because they have asthma. Nobody wants to, in quotes, like a liability. So these are some of the problems asthmatics have been facing. And in recent times, the cost of medication has gone really high, and you have students choosing between eating and getting an inhaler. So all these are part of what Just Breathe tries to like work on, see where we can get inhalers from trusted sources, because there were a lot of fake inhalers in the country, and that was really, really serious. Because the inhaler is meant to like help, but it doesn't help him because it's fake. So that's just some of the things we have done so far.
That's fantastic. Well done. I want to commend you for starting this foundation. And just in case there's anybody listening that thinks, you know what, I'd like to support this young lady in what she's doing, can you give us a phone number where they can reach you?
Yes, my phone number is 0803 792 1511.
Please repeat.
0803 792 1511.
That's great. And so at what age did you find out you were asthmatic?
So I found out at 10, 11, but according to the doctor, it had always been there. It was just dormant, unlike my younger brother's one that showed from birth. So it just started with wheezing, chest pain, and eventually in school they thought I was pretending. I went to boarding house, so they thought I was pretending because it wasn't in my health history until when I had to go back home, and then I ran some tests, spirometry, and they found out that I actually had asthma. And it was not hard for them to figure it out because both my dad and my brother were asthmatic, so there was already like a trait in my bloodstream.
Well, thank you very much for that. And I like the fact that you are supporting others with your, your support group, as well as going out and educating people. That's tremendous. And I'd like you to just really keep that up, because it's so important that people know about it. A lot of people from the higher socioeconomic status, groups, they tend to know more about it than people in the lower. And it affects everyone across board. There's no respecter of persons. So I think it's important that this work that you're doing, you carry on doing it. So very well done. Dr. Anga. Dr. Anga, Yewande has spoken about the medication, and we haven't really talked about the drug treatment of asthma. She spoke about the inhaler. Is the inhaler enough? Because she obviously was talking about the cost of the inhaler, but and I presume that's the Ventolin inhaler she's talking about. But there are some new treatments and new ways of managing asthma. Can you share with us what those are about?
Well, you have the gold standard treatment for asthma, which she's mentioned already, the inhaler. When we're treating asthma, we have two basic groups of drugs that we use. So we have what we call the bronchodilators, which act as relievers and have a quick onset of action and a shorter long-term span of action of up to 4 to 6 hours. And what people commonly know about is Ventolin, the salbutamol. So that acts as a reliever. And then you have inhalers with steroids in them, very low dose steroids, I must emphasize. And these are what we call the controllers. So these are used long-term and daily to control the symptoms of asthma. But having said that, it's used for people you have to classify the asthma. The doctor has to take the time to decide which medications you need and educate the person with asthma and discuss the options and also identify triggers. So because without identifying your triggers, you also need to either avoid them or get rid of the triggers within your environment. So low dose steroids reduce the secretion of mucus, which we described within the lungs. Then we have what we call leukotriene receptor antagonists, and those modify the disease process, the inflammatory process. When we have a response, when you have an allergen or a reactive response, asthma can sometimes also be called reactive airways disease. So you may be responding to an allergen, or you may be reacting to an allergen, or reacting to some other environmental things like chemicals in the environment, smoke, etc., which we talked about. That would induce an immune response which produces IgE and other products like histamine and leukotriene. So we have drugs that prevent the release of those substances. And sometimes you prescribe, for example, Lucast for that. The newer therapies, I'm not sure, one new therapy is what you call immunomodulation, where you introduce small amounts of what you identify as the trigger to the person with asthma over a period of time. It can take up to a year, and eventually the body gets used to that substance, and the reaction, exaggerated response, no longer occurs. And so that's, in a nutshell, what we, how we treat asthma.
Thank you, because prevention is key. Are there any other things an asthmatic can be advised to do to manage or to prevent asthmatic attacks from happening?
Well, you have your triggers, which we talked about. So identify those triggers. We can also, when asthmatics who are above the age of 5, you can track how well your asthma is controlled using a device called a peak flow meter. So it's a device, simple device that you blow into, and it looks at how forcefully you can breathe out air and the volume of air that you produce. And there are expected norms for each age. And then you also get to know what your normal is, and you track that daily. And if it begins to fall below the expected, your doctor will advise you on steps to take, for example, like increasing the dose of your inhaler. So in that sense, you're preventing an attack and preventing an emergency.
So Dr. Anga, unfortunately, time is fast spent and we have no more time left. Do you have any last words for our listeners?
Well, the final, I have a few last words, which are that asthma can easily be diagnosed. It's important to know and understand your triggers. It's important that you have an action plan in place so that you can prevent attacks. And if you do all that, you should be able to live a long, active life with asthma.
Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.